Welcome to this webinar hosted by the RE Foundation. I'm Nikki Sheth, and I'm going to start off with some basic housekeeping items and tell you a little bit more about what this webinar is going to be about today. First, you might have noticed that you will be on mute today for this webinar, so you don't need to worry about muting yourself. Second, at the end of the webinar, we will have some time for questions. And if anyone has questions, you can use the text box on your screen to submit a question. So maybe you can take a second now to identify where that chat box is. I also just want to add that the webinar is being recorded and will be available on the RE Foundation site for those who were unable to attend or may need to leave early. It's also a great opportunity to come back to the content that you might be learning today. And lastly, I want you to know that after this webinar, the RE Foundation will be following up with an email with additional information as well as these slides for your reference. So there's no need to take extensive notes. And I also just want to mention that while we're here to answer your questions, we want to be sensitive to your personal information and HIPAA regulations. So if there are questions that we are unable to answer on the phone today publicly, we would recommend that you reach out to us on an email that I will give to you right now, and as well as at the end of the webinar, which will allow you to have the ability to schedule time with our information specialist for anything that's more of a personal matter. And that email is infospecialist, INFOSPESIALIST, @ChristopherReeves.org. All right, I think we're ready to get started. We appreciate everyone joining for the webinar today, and just to let you know, the webinar today is about navigating the insurance maze. The purpose of this webinar is to provide you information and overview about the health insurance appeals process and provide you with information and resources that you can use to navigate the process, which we know can be confusing, time-consuming, and often pretty frustrating. Okay, great. And I also want to start off by introducing some of the presenters we have today. All right, so I'm Nikki Sheth, and I'm joined here by Bernadette, who is going to be talking to you and starting off this webinar today. Bernadette has been with the RE Foundation for over 12 years as a director of our Information and Resource Services. Her professional background includes special education teacher, working in vocational rehab as a counselor, and also has just been tremendous to the RE Foundation in many ways, in providing resources and information to our community as well as the professional community. She brings over 22 years of experience, and we're happy that she's here to join us today. I'm joined here also by Bill Qualley, who is our manager for our Peer and Family Support Program. Bill joined the RE Foundation in 2009, and he currently oversees our Peer and Family Support Program, which we encourage you all to get involved in if you are not familiar with the program. He brings 16 years of experience in financial services and the nonprofit sector, and Bill, as well as Bernadette, is living with spinal cord injury. And lastly, I want to introduce Carlos, who's going to be one of our speakers here today. Carlos is one of our information specialists here at the RE Foundation, and he started with us in 2004. And Carlos has traveled and since then gathered a lot of great experience also as a translator, and serves as a translator to the foundation as well. One of the projects that he's working on that you can look out for is he's actually translating one important educational material that we produce, which is our paralysis resource guide. So he is very valuable to the foundation, and we're happy to have him on the webinar today. without further ado, I think I'm going to turn it over to Bernadette, who's going to start us off on the webinar in appealing Medicare coverage decisions.
Thank you. Appreciate everybody attending. To start with this slide on appealing the Medicare coverage decisions. First off, you'll have a Medicare summary notice, also referred to commonly as an MSN. And every 3 months, Medicare will send you an MSN, and on it will break down your name, your provider, the benefits that you've received, and what costs that you may be having to pay out of pocket. If you disagree with anything on the MSN, you have the option to file an appeal within 120 days of the date that you receive the MSN. The MSN is also available online and is generally available within 24 hours of the services. By reviewing it online, you can resolve your issues quicker and file an appeal quicker. Briefly, I'm going to cover the 5 levels of appeal for the original Medicaid. We will look at each issue more in depth. The 5 levels of appeal are a redetermination by the company that handles the claims for Medicare, a reconsideration by a qualified independent contractor, or QIC, a hearing before an administrative law judge, ALJ, review by the Medicare Appeals Council, or also known as the Appeals Council, and lastly, a judicial review by federal courts. So let's go into each one in more detail, starting with the redetermination. There are 3 ways that you can request a redetermination. First, if you disagree with the Medicare decision for payment on your MSN, you can complete the form as shown on the screen and indicate why you disagree. You'll provide the appropriate information and mail it into the Medicare contractor that is listed on the MSN. Secondly, you can write Medicare a letter. You send it to the original Medicare contractor, and you circle why you disagree, what the services were, what the costs were, and with all levels of your appeal, you're going to list your name, your phone number, your Medicare number, and you must sign every form. If you're going to have a doctor or an attorney assist you or another family member, you must also obtain their signature. Again, for every step, you will follow these same procedures. The second level is a reconsideration. If you don't receive the decision that you want under a redetermination, you go for a reconsideration. And this decision is made by a qualified independent contractor, and that is an individual that did not take part in your initial decision. The qualified independent contractor will review your request and they'll make a decision. Again, the process of submitting the form, when you receive a determination, they will tell you where to go on Medicare's website. You can get the forms, or the form is also included. You complete the form, you provide the necessary information. As always, provide a signature of yourself and or the individual who is assisting you. If you choose not to use the form, you may also follow the standard process of writing a letter and providing all the same information. Your third level is a hearing before an administrative law judge, also known as an ALJ. You go before an administrative law judge if you've lost the first 2 levels of determination and you disagree. Now, there are some restrictions to going before an ALJ. For 2004, the required minimum amount that you were disputing must be at least $140. The ALJ will decide if your case meets the minimum dollar amount. And you are able to combine claims. So if it's a wheelchair and they're denying your frog legs on your wheelchair, you can list that. And then you can add something else, like your seat cushion for the balance. So you are able to combine dollar amounts to have an ALJ review your case. If you have original Medicare, you would follow the directions on the Medicare reconsideration notice that you get from the QIC in Level 2. As always, you're going to receive a form as well as directions. And you will file your request for an ALJ at the Office of Medicare Hearings and Appeals. The address is listed on your Qualified Independent Contractor's Reconsideration Notice. Again, you provide the same information: name, address, Medicare number. If you have an appointed representative, you give their name, address. You give your document control number, the dates of the services, explain why you disagree, and again, most importantly, provide signatures of yourself or your representative. If you choose not to use the form, you may follow the same process in letter. If you want your doctor to request a level of appeal, you need to submit a form specifically for your doctor to provide supportive information. And this is called an appointment of representative form. And you can get this form at medicare.gov. Without this form, your doctor's information will not be considered, and your doctor cannot represent you in appealing a decision. The ALJ will make a decision within 90 days of getting your request. If you feel that the ALJ does not make a timely decision, you can take it up to the next level, to the Medicare Appeals Council. Next slide, please. Your next level of reconsideration is a review by the Medicare Appeals Council. To request that the Medicare Appeals Council review the ALJ's decision of your case, you need to follow the directions in the ALJ's hearing decision as provided on the screen. You must send your request to the address listed. And the address is going to vary by what portion of the country you live in. You would fill out the form. Again, provide the same necessary documentation, the reason why you disagree, the dates of services, the amount that you're requesting, and any supporting medical documentation. You can complete the form, or again, you can write a letter and provide all of the required documentation. Remember, if you want your doctor, again, this is very important, to request this level of appeal, you must submit an appointment of representative form. With the Appeals Council, they will send you a decision within 90 days of getting your request. If they don't make a timely decision, you can ask the Appeals Council to move your case to the next level. If you disagree with the Appeals Council's decision, you can then move on to the level 4, and you have 60 days to get the Appeals Council decision to request judicial review by the federal court. To get a judicial review in federal court, the amount of your case must meet a minimum dollar amount. For 2014, the minimum dollar amount is $1,430. Again, you may be able to combine claims to meet this dollar amount, and you would follow the directions closely that you receive in your Level 4 denial in order to file a complaint. Again, I can't stress it strongly enough. If you want your doctor or another medical provider to submit information, they must sign appointment of representative form. Now, there's a difference between the original Medicare versus Medicare Advantage. Most of the process is similar, but there are some important differences that you need to keep in mind. The main differences include coverage and payment notices, filing deadlines, and the decision makers involved in the early stages of the appeals process. In the original Medicare, the Medicare summary notices that Medicare's payment contractors send to you, they're different than your explanation of benefits, or EOB, that Medicare Advantage plans and Part D drug plans send to you. One of the major differences is in the time frames. In original Medicare and Medicare Advantage and Part D plans, the deadline for original Medicare is 120 days to file an appeal, but it's only 60 days for Medicare Advantage and Part D plans. This means it's very important to understand and know if you have the original Medicare or if you're using Medicare Advantage. The organization that decides on the appeal for the second step in the Medicare appeals process is a qualified independent contractor, again a QIC. In Medicare Advantage and Part D, an independent review entity, or an IRE, handles appeals that reach the second stage of the process. All of this information is provided by Medicare Appeals Rights and Procedures, and it can be found on the Internet and will be available with resources at the end of this presentation. I'm going to hand over the next part of this presentation to Bill, and he will discuss the Medicaid appeals process.
Hi, everyone. So I'm going to spend some time talking about the Medicaid coverage decisions and the process for appealing, as well as some tips. So why don't we start with knowing your rights. Obviously, it's one of the first things you want to be aware of when you're navigating the appeals process under Medicaid. It's important to know some of your basic rights, and these include a prior written notice of adverse action, that you'll receive a fair hearing before an impartial decision maker, that you have the opportunity to continue your benefits pending a final decision, and that there will be a timely decision for you, but that will be measured based on the date of the complaint being made, or when you make the complaint. We're going to go into a little bit more detail around some of these things, some of these tips. Excuse me. Forgive me a little bit. I'm fighting a little bit of a cold, so I apologize. In terms of written notification, typically 10 days before an action is taken on your coverage, you'll receive a letter from the state Medicaid office. There's going to be a lot of information in that. What we want you to look for, we want you to read all of it very carefully, but we want you to look for the didn't touch it. My mute went off for a second there, so let me just double check and make sure that you caught all that. So in terms of written notification, typically 10 days before an action is taken on your policy, you're going to receive a letter from the state Medicaid office. We want you to read that letter carefully and look for these things amongst the other things in the letter. The actual action, so in other words, what is it? Is it a denial of a claim, cancellation of a benefit? The explanation for that action, an explanation of your right to request a hearing and the process for requesting a hearing in your state. The rights you have in terms of having representation at the hearing, whether that be yourself, legal counsel, a spokesperson, and the explanation of the circumstances under which your benefits will continue if you make a request for a hearing. Thank you. So in the appeals process, these can vary by state, so we want you to be aware of that. And how the process works will be in the letter that you do receive. Hearings, the most important thing to understand, at least in the beginning, is that hearings must be requested within a reasonable period of time. And again, this can vary by state. It can be anywhere between 20, but it will not exceed 90 days. And that's from the date that the notice of the action is mailed to you. Okay, so it's not the day you receive it, it's when it leaves the actual Medicaid office. So it's important to keep that in mind. If you do want to continue to receive benefits while you're in the appeal process or in the hearing process, and this is often called aid paid pending or continued benefits, you do need to request that. And if you are going to request that, you need to do that within 10 days of the pending action. So in other words, if they're going to deny you a benefit and they're giving you a date of May 1st, you will want to make sure 10 days prior to that you've made the request that you're looking to have your benefits continued. If you miss that window and you still want to apply for a hearing, you can still do that, but the Medicaid may decide not to continue that benefit during that time frame. So it's obviously something you want to be very, very aware of. Other things to keep in mind, that your hearing request you cannot be denied a hearing request by the state unless you withdraw your request for the hearing in a letter or you fail to appear. If you do not receive excuse me, I'm sorry. If you do not receive a letter, if a letter is not sent by the Medicaid office stating the adverse action that's going to happen to your policy, it will be reinstated. And then lastly, what you want to be aware of is that if you do apply for continued benefits and you receive that while the hearing process is going on, but the Medicaid, the impartial person favors on the side of Medicaid, then you may be asked, or they will recoup the expenses related to that benefit during the time period of the hearing. So preparing for your hearing. Obviously, this is your best opportunity to make your case and make the case for the medical necessity of the claim or the benefit. So it's important to spend some time really preparing for that. And here are some suggestions we have for you. First, make sure you have all the documents. Bring pictures, bring copies of letters from doctors, emails from the Medicaid office or from social workers, whatever you think is going to help you make the best case for you in your appeal. We recommend making 2 copies, one for yourself and one for the hearing officer. And you might want to also just sort of have a list of what those documents are, kind of an index of what the different documents that you have so you can be nice and organized for the hearing. You do want to prepare a written statement. You want to write down the important facts of your case so that you can present them in an opening statement. You'll have an opportunity to make a closing statement as well. And you might have 2 copies of that you can also give that to the officer who's hearing the case. You want to bring your Medicaid notification, so bring the letter so that can be reviewed by the hearing officer. Identify any witnesses. If you want to bring people to the appeal or to the hearing, doctor, lawyer, someone to also represent you or speak for you. If they cannot attend, if the person cannot be in attendance, have them write a statement that you can read for them on behalf, again, stating why they think this is, again, a medical necessity for you on your behalf. And then lastly, you want to prepare questions. You want to go into the meeting being aware of what it is that you want to ask, any questions you might have of them, and any questions you might have for the witnesses that might be involved as well. And then finally, in terms of hearing your decisions, you will receive a decision in writing within 90 days of the date that you asked for the hearing. If you win, Medicaid will make corrective payments retroactively. If Medicaid wins, Medicaid will notify you of your rights to have a hearing decided or a hearing decision reviewed by the state court. And then if you've received services throughout the hearing, as I said, you may have to reimburse Medicaid for those services. And now I'm going to be turning it over to Carlos.
Thank you, Bill. We're going to be talking about the private appeals. So let's go back one. If your health insurance company does not cover a specific provider or service, you are within your right to file for an appeal. There are 2 types of appeals. There is the internal appeal, which is what we'll talk about first, and that is you dealing directly with the insurance company. Then the external appeal, which is when an independent third party makes a decision. For the internal appeal, if you go in this route, you have about 6 months or 180 days from when you received the notice that your claim was denied to file the appeal. If, however, your life or your ability to function is at risk, you may file for an expedited decision. To file an internal appeal, make sure you include make sure you complete all the insurance forms, or you can write to them directly with your name, your claim number, and your insurance ID number. Include any other information that you want them to take a look at when they are considering your appeal. At the end of the process, you must receive a decision in writing from your insurance company. If you are still denied the service or the payment of a service, you can ask for an external review. In the final decision letter from your insurance company, they're going to include information about this, directions as to how to go about it. But we're going to talk about it here. External appeal. This you must file in writing, and in the final decision letter that I mentioned, your insurance company is also going to include the time frame. It varies, but it's typically within 60 days of the date that they sent you the decision. So again, like as Bill was saying about something else, this is from when they sent it, not from when you received it. You can appoint a representative to file this on your behalf. This is usually a doctor or a medical professional, somebody who knows your condition well. In the letter with the final decision that the insurance mailed to you, they're going to include the contact information for this independent third party. This independent third party is going to issue the final decision. It may be against you, it may be in your favor. Whatever it may be, your insurance company has to accept the decision. External reviews are decided ASAP, no later than 60 days after they receive the request. However, again, you can, if your medical condition qualifies you, you can file for an expedited process. It'll come as quickly as required by your medical condition, within 72 hours after they receive your request. Please also keep in mind that you can file an internal and external appeal at the same time. And you can file an expedited appeal if the standard process puts your life or your ability to function at risk. Next, we're going to talk about tips for a successful appeal, and I'm leaving you with Nikki and Bernadette.
Okay, this is Bernadette again. So there's a number of steps that you can take to ensure that you have a successful appeal. I'm sure as you've heard, many of the areas, either Medicare, Medicaid, or private insurance, they cross over in terms of documentation. So it's very important that, number one, you know the appeals process and the specific deadlines and what your options are based on your insurance. Next, it's important to keep accurate and comprehensive records. I personally get copies of all of my medical records from all of my appointments. You have the right to request those from your physicians and have them mailed to you after each appointment. If you keep a file going, it helps alleviate any issues when you go to file an insurance claim. Also, make sure that you have letters from your providers, your own personal notes. Ask your doctor for a letter of medical necessity. Everything is driven by medical necessity. If you don't have it and you can't justify it as being medically necessary, it will not be covered. I've got a few personal tips that I have found to be helpful. Keep a marble composition book. The pages can't be torn out, and if you end up going before an ALJ, it's accepted as legal documentation. I attach a calendar to the back of my marble composition book, and I write notes for the days that I may call or send emails, because a calendar, again, is accepted as legal evidence before an ALJ. So using a calendar and a composition book where the data can't be altered is very important. Again, where possible, always get copies of the reports. I have found it very helpful to scan my medical reports and put them onto a flash drive. That way I'm not missing any pages and they're always readily handy. Learn your policy inside out. If you have private insurance, read their definition of what medical necessity is. It varies by plan. It varies by state. The same can be said for Medicaid. Additionally, it's very important to understand Medicare. If you think that you're not going to be impacted because you have private insurance, you're wrong. Most private insurance companies rely on Medicare as the standard for making their decisions. If Medicare is going to save them money, they follow the Medicare guidelines. So as you're doing your research, look at Medicare law, see what it allows, and then approach your appeal in that manner. Keep an accordion file. It helps you stay organized. If you choose to go with paper versus flash drive, you can break them down by physician, by date of service, by appeal. One of the main reasons that services will be denied is because a doctor's written down a wrong diagnostic code. If you're not sure, you can go onto Google, you can put the diagnostic code in, and it will tell you what it's for. If you're requesting a wheelchair and your doctor has done a diagnostic code that doesn't support a wheelchair, then you have to go back to your doctor and say, I think that may be a wrong diagnostic code here, can we correct it? And frequently that will change the entire process. Another important thing to do is go through pre-authorization where it's appropriate. If you go through a pre-authorization, the insurance company has a chance to take a look at your documentation, and it prevents you getting into the appeals process and restricting your time frame. If you look at pre-authorization, they tell you why you're not going to be approved for something. You can then gather that medical documentation and then move forward and be successful. And the last tip, if your insurance, whether Medicare, Medicaid, or private insurance, allows for case management services, request case management service as an individual with a chronic disability or health issues. They're generally provided free of cost. If you have a case manager prior to an insurance denial, the case manager can help you in an appeal. If you get a case manager after an insurance denial, they are not allowed to assist you. So it's to your advantage to use the case management services provided by your insurance company that are free of charge, because it can often help you get better medical care and prevent long drawn-out appeals process. That's it on the tips that I have. How we can help. The Paralysis Resource Center is a part of the Christopher and Dana Reeve Foundation. You can contact us via the internet at www.paralysis.org, and on the right-hand column there's a thing that says Contact an Information Specialist, or it also says Ask Our Experts. You fill out the form, and you can even set up an appointment time at your convenience, and we will contact you and we will answer your questions, and if we don't know the answers, we'll search for the answers to best assist you. Additionally, if you prefer not to go through the internet, you can reach an information specialist Monday through Friday from 9 a.m. to 5 p.m. by calling 800-539-7309 and ask the operator to transfer you.
All right. Thank you so much, Bernadette. And we want to now open for questions. I want to thank my colleagues here from the Paralysis Resource Center, Bernadette, Bill, and Carlos, for that very comprehensive and important pieces of information, all important for the appeals process. We realize that this may be a lot of information. You may be left with some questions, and this is the time to ask. We're gonna pause for about a minute because I'd like to give you all some time to think about questions you might have. And then I'm going to come back and see what questions we can answer for you for the remainder of this webinar. All right, so we have some questions we can answer today, and some of which you might see in your feed have already been answered. Just to answer one question, we can watch this webinar again, anyone who's interested, and I think that that has just been sent out on where you can find that information. A question that came today is a good question, and it asks, how can I stay calm and collect through the red tape hurdles? And we understand that the challenges, especially with private insurance, but perhaps even all spectrums, can be challenging, and there is a lack of sensitivity perhaps to the time that you might be feeling. And I'm going to turn over to Bernadette to give us some informal advice on that.
One of the questions asked specifically about equipment and staying calm and moving through the process. What is very key in being successful is to keep detailed notes, to know your policy, and to know what route of the appeal process will be the fastest and which will move you through with the least amount of hurdles. I'm going to use a personal example. The first time I requested my wheelchair, I did the paper appeal, and at the end of more than 180 days, I still didn't have authorization for a wheelchair. The second time around, I walked away, not literally, but I left the insurance process, and I came back 3 months later. We filed the same paperwork. I already had an insurance case manager in place because I found out the hard way they can't help you once you're in the appeals process. I was denied within 5 days for the wheelchair, and my physician did a expedited appeals, and they did physician to physician. I had a decision within 5 days after the denial for approval of a wheelchair. That's as opposed to the more than 180 days the first time when I did the paper route. So it's important to know and to work with your physician as to what strategy works best for you. Clearly, you can't be without your mobility device for a prolonged period of time, and filing an expedited, if your physician is willing to work with you, is going to be to your benefit. But it's important to know what your plan covers. So thoroughly read that from your plan, read it on their website. If necessary, go through the appropriate medical steps to have a strong letter of medical necessity. But most importantly, document, 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 and then document again. The last tip, it's important to stay calm and collected, to try not to take it personally, although it feels very, very personal. And know that what is often the case is to wear you down, to get you to go away and to pay for the services yourself. More than 80% of people do that on denials. So if persistence pays off, it does get tiring. It does feel like they're dragging their feet, but it is not personal. It is just unfortunately how the system works.
Thank you, Bernadette. So there's a second question that's come in, and if I understand it correctly, I think it's asking about DME. And pardon, I'm a little blind, so just give me a moment. Okay, so it asks, how do I know what I can ask for, and in terms of coverage for DME, and it gives the example of standing wheelchairs. And Bernadette, I think you had a sense of what this individual might have been asking in this question.
Yes. Standing wheelchairs are generally not covered under Medicare, Medicaid, or private insurance, although there are times that you can make a case for them. You probably have a better chance of getting a standing wheelchair covered through vocational rehabilitation if standing is a necessary component of your job or your schooling. So that may be one route to look at instead of going the conventional insurance. Let your insurance pay the primary part of it and use other related services such as voc rehab to pick up the expense. But how do you know what's covered? Well, that again refers to your plan. It becomes your Bible. You just have to know it inside and out, and it does break down durable medical equipment. So if you were to have Blue Cross Blue Shield, you can go look up your policy, put in the keyword durable medical equipment, and it will break down exactly what they will and will not cover for a wheelchair, shower chair, and under what parameters they deem it medically necessary.
Thanks, Bernadette. There's another question here that asks if a case manager at a skilled nursing facility can serve to help and can be used through the appeals process. So just to repeat, the person is asking if a case manager at a skilled nursing facility, which happens to be the facility of the patient and the family member that is being discussed, can be used to help in the appeals process.
I'm going to attempt to answer this, but I'm also going to ask that the individual who submitted the question to please give us an email address so that one of my coworkers, either Kathy or Donna, will assist us in finding out a little bit more detail. I don't want to ask somebody to disclose too much private information. My sense is it's going to depend on if the long-term care facility will allow the case manager to assist you in an appeals process. If part of the appeals process is that they provide documentation, then that may be reasonable. But if you are asking them to serve as your personal representative, their employer may say no. So that's going to be on a case-by-case basis. But again, this is an off-the-cuff answer, and we would like to check it out, knowing a little bit more details about the individual and what state you live in and who your payee source is.
Thanks, Bernadette. And we did receive that email, so thank you for sending. And for others on the phone today, if you do have a question that's very specific and perhaps personal, we can do our very best to answer them. And please, there's two ways to do that. You can send us an email at infospecialist@christopherreeve.org. You can call our number, or you could also just right now type in your email address, and we will have an information specialist reach out to you. We do have another question, and it's a general question that asks, what is the best way to obtain a copy of a private insurance policy? And I suppose the question, what is the best way to obtain a copy of a private insurance policy, is related to perhaps obtaining your policy that you might be signed up for.
This is Bernadette, and I'll attempt to answer this again. I've gone through our human resource department anytime I've needed the full policy. There are, if you have Blue Cross, Aetna, United Healthcare, there are multiple versions of the plan. So you cannot always find exactly what you're looking for online. It is important that if your private insurance allows you to log in online, look at your explanation of benefits, what's being paid, what's pending, what's denied. Frequently, they have coded in based on your insurance number what your policy plan is, and you can drive there. But I don't find that a 100% accurate way to go. Whoever is the primary on the policy should ask their employer and or human resources for a copy of that plan, and if it's necessary, to contact the broker. Many employers are self-insured, and in those situations, human resource almost always has a copy.
Thanks, Bernadette. And Bernadette, in the case that this person might not be employed or may not be receiving their insurance through an employer, but perhaps directly purchase their private insurance, I would assume your suggestion would be, of course, to reach out directly to the private insurer when there isn't that HR representative.
Yes.
Yeah. Okay, great. And we're just going to wait another minute to see if there's additional questions that come in.
For the individual who submitted the question regarding competitive bidding and private insurance as your secondary insurance, if you would please put in an email address so that somebody can reach out to you. It would be helpful to know if Medicare or Medicaid is your primary and what state you live in. Not all states are currently involved in competitive bidding as outlined by Medicare and Medicaid. Generally, Medicare and Medicaid are your primary and your private insurance is the secondary. If you are denied by Medicare and Medicaid, then you can frequently get your private policy, which is secondary, to pick up what is not normally covered. But it's going to vary by state, and it's going to vary by whether you've got Medicare or Medicaid. So again, if you would please submit your email, and somebody will reach out to you, and we'll get more details, and then we'll look into that answer for you.
Thanks, Bernadette. And we do have a question, but I think it's best to answer through email a question about any medical expenses that are not reimbursed through the IRS rules. And I want to state this out loud because we're going to be addressing this individual's question through our information specialist, but if others have questions on this, please don't hesitate to reach out to us. Do we have any other questions for the webinar today? All right. Well, we want to thank you all for joining the webinar today, and we realize that we're finishing a couple minutes early, so if you think of a question that could be helpful for you, we encourage you to reach out to our information specialist and send us an email at infospecialist@christopherreeve.org or pick up the phone and call the Reeve Foundation. We're happy to help. We want to thank you for joining and sending your questions our way. I want to thank my colleagues again, and thanks again for your support to the Reeve Foundation.